On the Medical Watch tonight, COVID and cancer.
WGN medical reporter Dina Baer has more on the connection.
The concern for the virus may lead to an uptick in cancer diagnoses and deaths. As people avoid the hospital and preventative screenings, cancer is growing, undetected and unencumbered. Doctors say following the pandemic start and quarantine, there were fewer cancer cases, but now they're seeing patients and their cancers are at a more advanced stage.
I'm extremely distressed by that. Finding cancers earlier are associated with a much higher rate of control and survival.
Less than half the women who normally get a mammogram got their screening from March to July. Doctors know from typical years there were breast tumors growing in that time.
I don't think there's less cancers. We're just not seeing them.
Visits to the gynecologist for routine pap smears, which also look for cervical cancer, were down dramatically. Fewer people got their colonoscopy, and men did not go for their PSA test to detect prostate cancer.
People under age 80 in this country, cancer is the leading cause of death. And we don't want to take one problem and switch it for another. I hate to think of it, but long term, you would think the implications are we're going to have a spike in cancer-related mortality down the road.
The secondary health crisis is one impacting many fields of medicine.
So I think it's not only the screening that we worry about, it's people so scared to go in when they have a symptom that they're not going to see their doctor. I have seen a couple patients who ignore some symptoms. They probably ignored more than they would have ignored. I know some patients who delayed their surgeries because they were scared.
Heart attacks are projected to rise, diabetes complications expected to get out of control, and cancer prognoses likely to worsen.
I worry that when we don't diagnose cancers early, we certainly know it's a little bit harder to cure patients as the disease progresses farther.
The advice? Be cautious, not fearful.
I would very much encourage people to continue their general medical care, whether it's cancer screening, whether it's they have a symptom, whether it's blood pressure, diabetes. I'm not only worried that we're going to have a spike in cancer mortality, I'm a little worried we're going to have more deaths related to chronic diseases because people aren't getting taken care of properly. But my main message is don't ignore your health care because you're worried about the pandemic.
More than 1,600 people die every day from cancer in this country. Heart disease and cancer are the top killers in the United States. And doctors say that threat continues today and will exist long after COVID-19 is under control. Back to you.